All right, guys, let's do a pelvic exam in Spanish. So this is the all Spanish version where you'll hear everything in Spanish. If you want the version that's English followed by Spanish, so you hear the English and then the Spanish translation, and you're on YouTube, just look for the link below. And if you're on the podcast, just look at the timestamps to see where that starts. So this is for ER or urgent care. There's just a couple main differences in what we do versus like gynecology or family practice. We're not going to do a pap smear, and we don't always have stirrups. So that's the main difference. All right, and when I turn my head this way, I'm talking to the patient. When I turn my head towards you, I'm providing some clarification or whatnot. Okay, so let's go ahead and get into it. Again, I'm going to go through the whole thing in Spanish, starting now. Sería prudente hacer un examen pélvico. En otras palabras, es un examen de la vagina, el útero y los ovarios. ¿Está de acuerdo? Favor de quitar los pantalones y la ropa interior. And then I would probably step out at that point, and then we'll come back. La enfermera va a estar con nosotros para ayudar. Por favor, si puede poner sus pies aquí. So that's referring to the stirrups, if you have stirrups. Ahora se puede acostar. Si se puede mover las asentaderas para que queden al borde de la camilla. Un poquito más. Muy bien. Favor de doblar las rodillas. Ponga sus talones juntos, así. Ahora separe las rodillas y relájese. Un poquito más. Muy bien. Perfecto. Va a sentir que mi mano la está tocando. Ahora va a sentir que estoy introduciendo el espéculo. Favor de aflojar los músculos donde siente la presión. Ahora estoy viendo el cervix. Voy a tomar una prueba para infecciones. Ahora voy a retirar el espéculo. Now we're switching to the bimanual exam. Necesito meter 2 dedos para revisar el cervix. ¿Siente dolor allí? Estoy revisando el útero y los ovarios. ¿Siente más dolor que lo normal? Ok, ya terminamos. Con cuidado, puede sentarse. Voy a salir para que pueda vestirse. Okay, so that's the pelvic exam in Spanish, all in Spanish. Obviously, in real life, you'd have to pause a little longer between some of those phrases, but that gives you the general idea. And if you want to get the English followed by the Spanish, the longer version, then check out the link below if you're on YouTube. And if you're on the podcast, you should have timestamps to show you where that is. And if you are on YouTube, I've also got a playlist here with a bunch of other medical Spanish dialogues about other topics, and a playlist here with a bunch of really high-yield beginner Spanish. So basic Spanish, the 80-20, like some of the most common stuff. All right, thanks for watching. I'll see you next time on Learn Medical Spanish.